This is Ayurveda Health and Wellness Podcast, where you get to meet the best Ayurveda practitioners so that you can transform your life through Ayurvedic science. Hello everyone, and welcome to yet another episode of Ayurveda Health and Wellness with me, Hitesh Anand, and Dr. Kanika Verma. Today we are going to talk on a really interesting topic, which is Humanitarian Ayurveda. Dr. Kanika Verma will explain us what Humanitarian Ayurveda is and how it should be adopted in today's modern society, and how the economics of Humanitarian Ayurveda works. So, hi Kanika.
Hi Hitesh.
So, first of all, if you can explain to our viewers and listeners, what is humanitarian? What do you mean by humanitarian Ayurveda?
See, Humanitarian Ayurveda, essentially what I mean to say is that it works for the humanity. I worked in pharma sector as a strategy manager, and I know how the wealth flows in this entire market, where the focus is on diseases, on curing diseases. So when I was a trainee, I was taught a term called cash cows. And you'll be surprised to know what these cash cows are. The cash cows are the patients who cannot get cured. And they have to manage their disorders throughout their lifetime. For example, a person who is diabetic or hypertensive or has some kind of hormonal imbalance like hyperthyroidism, something like this. This person has to go on taking medicine, and especially when I was working in rheumatoid arthritis department. Rheumatoid arthritis has no treatment, only management, only painkillers, and some immunosuppressants which will suppress your immunity so that your immune system doesn't attack your joints. But this is not treatment essentially. This is just like putting off the treatment.
Right.
So these people were called cash cows because once you get this disease, you have to go on paying for a lifetime.
Right.
So you see, this is a very, very strange approach towards sick people, that you can call them cash cows, and these are the people that we can extract money from for a lifetime. So, you plan your strategy accordingly. And there have been so many news. For example, in India, there was a news that India is going to be the diabetic capital when I was still working in the company. And, company people were happy that India was going to be a diabetic capital. So this is a completely different set of economy at work.
Right.
It's a completely different set of economy. Whereas if you now, with this perspective, when I saw this happening, I was better able to compare the practice of Ayurveda as it is prescribed in the ancient text vis-a-vis this current economy that we have for sick people. The pharmaceutical industry, the healthcare industry, the way they function, it's starkly different and it is not sustainable. So, you see, the Humanitarian Ayurveda, the Ayurveda, or I would say any ancient medicine, whether you look at Chinese medicine or the Tibetan medicine, all have a humanitarian approach, which is very, very different. We get to know about it only when we suffer, at the hands of the current healthcare practices. So when you look at Humanitarian Ayurveda, there are some salient points. For example, there is no fee for learning Ayurveda. When you would go to a traditional Gurukul, the students, they were taken up as children, the children of that Guru, and he would feed them, clothe them, teach them everything, and after the education is complete, then you were supposed to pay anything. Today, I see people joining medical profession. Sometimes they pay a lot of donation, just to get in there. And by the time they complete their education, the main aim is not to serve the society anymore. The main aim is to pay back that loan.
Yep, that's right. That's right.
In my case.
Yeah.
So main aim is to pay back the loan, and therefore you just need to extract as much as possible because the entire orientation changes.
Right.
a person who's 17 years old, 18 years old might join the profession with a beautiful heart,
Yeah.
a heart to serve. But by the time they pass out, they are completely different people.
That's right. Yeah.
So that is one aspect of medical education. And the another aspect is that you see, Ayurveda focuses on prevention. If I focus on prevention today, I will eliminate all these cash cows. Because if you're focusing on prevention of diabetes, if you're focusing on prevention of hypertension, and it is possible, it is not possible. It is possible to prevent diabetes. It is possible to prevent all lifestyle disorders. Okay, but the major focus is not on prevention. The major focus is on cure or on management of diseases, because you make cash not by prevention. You will not make cash when nobody is falling sick. You can make money only when people are falling sick, and this changes the direction in which we put our effort.
Yeah.
So if you look at major research studies that are funded, they are not funded on prevention projects. They are focused on finding out a new drug for a existing condition. For example, a better anti-diabetic drug or better anti-hypertensive instead of preventing. They are focusing on this. Entire money is funneled into this. And when this happens, you see, they put in a lot of money, the pharmaceuticals, to discover a new drug. And when this drug is actually launched, the focus is not on bringing relief to the people who are sick. The focus is on extracting back the money that you've already put in.
Yeah.
And so you see, in pharmaceutical industry, there is a very separate premium pricing. First is skimming. This again a term I learned as a manager. Skimming means, when you boil the milk, the cream is at the top. And these are the richest people. So you first offer medicine at a very, very premium price so that only the rich can afford and the poor cannot afford. But then that's okay. So the rich people, when they start affording, and you have already realized some of good profits, then you start putting medicine down to poor people unless and until government comes in and says that okay, this is illegal. So this is the general trend which is not humanitarian. Skimming should not happen with poor people, with sick people. You see, poor people also fall sick. But they cannot be skimmed. So they will never get the benefit of a medicine which is newly launched. Okay, for example, better medicine for HIV medicine, for HIV treatment, or better medicine to control cancer or its after effects and so on and so forth. So this is the current scenario, whereas in Ayurveda, there is a different thing. It is completely different in the way the aim of Ayurveda says that swasthasya swasthya rakshanam aturasya vikar prashamancha. That means first protect the health of the healthy and then cure the anxious. I love this statement, because once you are focusing on prevention, and with a focus on prevention, I'm sure that we'll be able to prevent 99% of disorders, even diabetes, hypertension, and all these things. We'll be putting more funds in healthcare centers, in gyms, and exercise centers than on hospitals.
Right. Yeah.
So the entire focus of society changes. Prevention becomes a focus, and when prevention becomes a focus, and you're able to prevent disorders, then then what happens is you save the manpower. You save the man hours that the person spent on being sick. You save the taxes that are spent by state on hospitals. You save a lot of things. And if we look at current scenario of developed countries, there is a lot of aged population. I don't know, I heard about Britain, that there's a lot of aged population, and they have a lot of disorders like Alzheimer's, dementia, hypertension, diabetes after a certain point in time, because they are living very long. Okay, and so the state has to bear all these costs. But if the focus would have been on prevention, probably now the older people would have been healthier. And it saves everyone. It saves time, it saves energy, it saves money. it saves the state, it saves the individual.
Yeah.
So Ayurveda has this focus, and that's why in ancient times it was said that sickness happens as a result of providence, because the food was good, lifestyle was healthy, everything was healthy. So why would people fall sick?
Right.
In India, I will tell you, diabetes was unheard of some 30, 40 years back. It was like very rarely people will be diagnosed with diabetes or hypertension.
That's true. Yeah.
Yeah, because there was no outlet for pizzas and burgers. People used to walk. There was less of sedentary lifestyle. So, it was natural that they did not get diabetic. But today, they will get diabetic, and the focus is not on prevention. The focus is on selling more pizzas, on more burgers. So, all the industries benefit. The FMCG industry, the food industry, the pharmaceutical industry, they all work together, they all benefit. So this is a very different approach.
Yeah, that
Right.
I mean, that's a really amazing. How Ayurvedic approach is so different, not just in terms of the medicines, but also humanitarianism. In terms of humanitarianism as well. And it's actually opposite to what the current approach is by these big pharmaceuticals. And my question would be, Kanika, I mean, this is such a noble way of living, the Ayurvedic way of living, and how do we fit in Ayurvedic in today's commercially minded world, where if for example, you being a consultant and you do not charge fee, then how would you survive and live? Or just for anyone who is practicing yoga and Ayurveda, and they have to make their livelihood, they have to live in this world. So how do they sort of fit in here and make this possible?
There are ways, and first thing I'll tell you, I do charge. I do charge. Initially, I started with not charging, but I started charging because when I consulted people without charging, they didn't believe me.
Yeah.
Yeah, they didn't believe me. They thought, okay, fine, probably she's just saying something because she wants us to get hooked, and wants us to get used to it, so that probably she'll be charging premium after some time. So I started.
Yeah, that's the thing. We are so conditioned to these things that if someone is actually trying to be good, and then we are skeptical, like, why is this person being so good? How can someone be doing good without without caring for money? So yeah, that's true.
Yeah, but then I do one thing. I always ask them that if you have any problem, please let me know, and I'll be happy to offer you free consultation. So yes, some people, they do come back and say that, okay, I have this problem, and we have some financial problems, and also I have a certain day on which I do not charge. Like for Saturday, I go to, there are some orphanages. You see, I now realize that we have to implement Ayurveda according to modern times. And so I don't charge in that orphanage where I go. I don't charge to the old age home. Okay, because these people naturally need. And also, there is one very, very beautiful thing that Vaidyas in ancient time, they charged. They charged.
Okay.
It's not they never charged. Okay. There was one way of getting money was the grants from government or the king or whoever was there. The second way was charging the rich. That's charging the rich. For in Ayurveda, it is said that you should not charge for consultation. Okay. So, and this is so important because consultation, advice can actually heal you. According to Sushrut Samhita, it says that Nidan Parivarjanam, or removal of the cause, is permanent treatment, which is true, right? If you have bad lungs due to smoking, no medicine can cure you unless and until you stop smoking.
Okay, right.
So stop smoking. This is the cure. And this is the permanent cure. So if I have to give free advice to someone, I will say that please stop smoking and your disorders will be gone. Okay. And this is effective. This is very effective. A poor person who really wants to get cured will follow my advice and he will get cured. Or I can also add something that, okay, take this herb, something like this, and you'll get cured. Fine. So it is available for poor people. There is an option to get cured. If they choose to get cured, there's an option that authentic advice will be available to them. Okay. Another thing is like rich people, earlier in ancient times, they would give donations, which will be much more than probably Vaidya will ask for. Say, for example, I ask for 1,000 rupees, but a rich person might choose to give me 5,000, 10,000 rupees for the same thing. So right now what I do, I charge people. I charge people who can give. So that is one thing, that is one point taken care of. Another thing is, in ancient times, Vaidyas will not charge for consultation, but they will charge for medicine. Because medicine was tailor-made. It was made according to the condition of the person. And most of the time it was made by hand. So it involved a lot of manual labor. And Vaidyas will do it themselves. Because it is said that if you, now there is a concept that if we are living in a virtual reality. I don't know if you've come across it. And sound. Water has memory. Sound creates memory. So if you're chanting a hymn or a shloka while making the medicine, that medicine has a different effect. And today I believe it because I have heard about the water memory. I'm sure you also must have heard about it. So Vaidyas used to make it by hand, and that medicine was very expensive. And the rich people will pay for that very expensive medicine, not for the herbs, but for the effort. Yeah. And this very expensive medicine will earn good income to that Vaidya. Now, the medicine, whatever medicine, a Vaidya will make 1/11th part of that medicine he gets to keep. Okay, so the other 10, the other 10th part will go to the client or the sick person, but 11th part of that medicine, which the Vaidya is making for the rich person, he will get to keep. He can sell this 1/11th part of the medicine or use it for treating the poor.
Okay.
So that, because that medicine is so expensive, he can sell it for a good amount, okay, to some middle class people. Or he can use it for treating the poor people, which again brings me to a very beautiful point, that medicine that is given to the rich person, same quality of medicine, the poor will also receive for no charge, for no, price.
Yeah.
So he'll not have to pay. Say, for example, I am a Vaidya making a very expensive medicine with gold bhasma and diamond bhasma and all this for a very rich person. I get to keep it. So I can either sell it and it will be sold for very, very good price. So I get good money. Only from one or two people I can get good money. And when we know about niche products, they are always expensive. You don't have to sell to a lot of people. You just sell to few people, get good amount.
Yeah.
So here I get good amount, or else I can use this medicine to treat someone poor, and that poor person will benefit free of cost, and he will get medicine comparable. That same quality of medicine he'll get as the rich person. So that brings a kind of equality in society. It bridges the gap. Yeah. So even a person who cannot afford gold bhasma or diamond bhasma will be able to get that medicine because the rich person is paying it. And here you don't even need the government intervention. The Vaidya as a community, they can bring about this social balance. And it is so crucial because sickness is a huge problem. It can debilitate an entire family. It can bring the society crashing down. If many people are sick, they're not able to work, their children suffer, everyone suffers.
That's right.
Yeah, so the Vaidya as a community, they can help to bridge this gap, even without government intervention, even without legal intervention. So, you see, that was a huge factor which helped in this gift economy. We have gift economy according to Vedas. So, where people are not looking forward to extract money, yeah, they're not looking forward to extract money, they give, and the things that they give come back to them in a cycle. Yeah,
Right.
so here here the and see, there is a concept of ikigai in Japanese culture, where this ikigai is essentially the social security which people do not get from the government, but as a society. The society is so closely bounded that the people don't worry that if I die tomorrow, what will happen to my kids? Because they know the society will come forward and take care of them. You see, this is better than insurance. This is, and the people who live in this kind of society have less of stress, have less of anxiety disorders, have better health. You see, and they eventually move away from all these problems which are caused by stress. After all, we know that diabetes, stress is a major factor for diabetes. It's major factor for heart attacks.
Yeah.
So people in Japanese culture, they feel protected by the society, and that's why they live longer. Whereas people in other countries where the society is disrupted, you know, even the families are breaking away. They feel unprotected, and that's what leads to a social illness. Spread of mental illness in a society.
It's true.
So here we are protecting so many things. We are protecting the entire fabric of society. And here is one point: is like the community has to be the Vaidya community has to be free of corruption. It should be led by good people. So yes, there can be all kind of people everywhere, but overall, it's a gift economy. It's a humanitarian approach towards healthcare.
Yeah, that's really, I mean, really interesting. And in today's situation, it's hard to sometimes even think like how can in ancient times, how was this even working? Because in today's time, it becomes so impossible when you think like people, whether it's kind of Vaidyas or the doctors in today's time, or the patients themselves, everyone is so kind of money minded, and they want to make more money, extract more money, and I guess there are certain areas where this can't work. This should not be there. Health being one of, these are the basics, basic responsibility of the society to take care of the health of everyone. Food being the other one, it should not be compromised, in any ways. But whether it's a scarcity of food, whether it's the quality of the food, because again, it comes down to health of the society as a whole. And what, of course, as you said, what pharmaceutical industry is doing, they will never want that people should not should be healthy. They would always want people to be sick, and that's how they are making money, and that is why they are getting bigger and bigger, and with more. We have been hearing about what Pfizer has been doing with many countries across the world. They are forming agreement with the government that they can't file a lawsuit against them in future. Only then they will provide vaccine. These kind of complex agreements, so that Pfizer doesn't have to worry about anything in the future, and that's what they are asking for in exchange of COVID vaccines from different government. Because of course, not all government can afford the vaccines. There are so many countries where and everyone is desperate to have the vaccine because no one wants a citizen of the countries to die because of the pandemic. So it's this is the most opportunistic approach by any company that I've seen, and it's really disheartening. And I mean, there has to be a way to dismantle this industry and probably come up with an entirely new system which actually cares. I mean, in that sense, I would always say that to some extent the countries, even to some extent UK and other European countries that have the government-based health system, at least to some degrees, government take care of the health of the people without charging them, and also works on improving the preventing the the diseases and kind of giving them healthy lifestyle, opening more gyms or encouraging healthy lifestyle. But still, eventually, the system is a lot more complex than we imagine. So, yeah, I guess, of course, as we talked earlier as well, Ayurvedic practices could be the best one for where the countries where government is taking care of healthcare system, because it is based on prevention.
Yeah. You know what? One thing came to my mind is that I can survive without charging. Today I know it and I know how. Because I can. Today there's so many ways to earn, not one. And I have my YouTube channel. I can earn from that. I'm vlogging on Ayurveda, and there's so many people to pay good sum for it.
Yeah.
And for any future Vaidya, I would suggest that yes, you can do it, because there are many other ways. Education, I can provide Ayurveda education, and I have my courses on Udemy which are free of cost, okay? But then there's still some donations pouring in, which help me to believe in that humanitarian approach. It still exists because I have lots of donations on patreon.com. So sometimes I really think that should I charge or should I not charge? And I offer to people that, okay, if you don't have money, please tell me, it's fine. Okay. So it's like that. So money comes to me not in the form of fee, but in the form of donations. And you'll be surprised, it's not small amount. So it's not small amount. Besides, there is another very important factor for any Vaidya or anyone who practices Vedic education, is that minimalism. I started practicing minimalism some 2 years back. Before that, I was really worried about how to earn. Okay, so basically, I just have to change that direction. Instead of before I understand humanitarian Ayurveda, I have to understand that what is right way for me to live. I cannot have two television sets in my home and I don't know what, probably 60 clothes in my closet which I don't even know that they exist, or 20 pair of shoes or something like this. 2 years back I watched this documentary. I was anyways not a hoarder previously, but I watched this documentary about minimalism, and they talked about having only 5 pair of clothes and about 2 pair of shoes, and I thought that why not? Because a person who really wants to understand Ayurveda has to have this approach of giving up the grossness in life. It's not about giving away material, throwing away things from your home, but giving attachment to the things that you own. Because you see, it's not about information. Ayurveda is not about information. It's about developing a certain subtlety, a certain level of wisdom.
Right.
And when you really want to develop that wisdom, I think minimalism is the way forward for any Vaidya.
I guess I would say minimalism is way forward for anybody. I mean, any person in general.
Any
I
Awesome.
mean, why would you like? See, there's another aspect to it. Why would you want to consume so much? And when everything has impact on what you're doing on the planet, on the nature, on you know, uh, so why would you like to disrupt the harmony of the nature because of your greed to consume and to look good or to I guess our aim should be to be happy, to be healthy, and to be happy and to be healthy. You do not need more things. You need less things.
Yes. You need less things.
S-
You see, because when you have less things, you don't have any problem in sharing. Now I realize earlier I would hide things from my friends when I was in college because I thought that probably, they will eat up my stuff and blah. But today, when I'm used to living with less, sharing is fun.
yeah.
Sharing is fun. Bonding is fun. And we do not live on bread alone. We live when we connect with people, when we live on love that we get from people around us.
Yeah,
So
that's
you
right.
see,
And when you do not stretch yourself by buying unnecessary stuff, then you have money to give to someone who actually needs it, or help your friend or your someone you meet. I mean, there is things that you can do which will actually uh, help in improving the life of someone else, rather than
yes,
you just consuming it, and most of the time this overconsumption leads to wastage, nothing else. I mean, almost
nothing else.
every time, actually, not most of the time,
Almost every time, yeah.
overconsumption would lead to wastage. And I mean, it also depends like what you are focusing upon. You want to build a better world, you want to build a better life for others, or just want to build things for yourself. So yeah.
Yeah. So, yes, you see, I would like to add one more thing is that with minimalism, I essentially started practicing it, and now I have like 5 clothes. I really have them. So, and 2 pair of shoes, and I'm so happy because there's less to clean,
Yeah, that's right.
less to clean, less to
I mean,
manage.
it's also less time in wasted on decision making. Like I
Yes.
have like a certain set of t-shirts which I wear uh, pretty much all the time. And it's very easy. There's no much design. They're simpler. Plain t-shirts. Most of the time, you just have to pick. Without thinking, like, how should I look today? Just whatever is on the top, just pick it up and go on. And so it makes a life a lot easier as well. Your thinking process, thinking energy is saved, and you can use it
Hmm.
better somewhere else rather than making such unnecessary decisions.
Yeah, correct. So you see, essentially minimalism then leads to essentialism, which is another thing I read. Essentialism means because I have so much of time left, uh, saved from all these extra earning and extra expenditure, I can focus on what I really love doing. You know, uh, I was in a very good job. I was initially manager, then I became strategy manager for one division and for two divisions. It was like a very good job. Okay, but then every day I really felt, oh my god, if I really want to get out of this place, I really want to get out of this place. I started thinking, and I thought, because for a middle class Indian person who has whose main aim is to build a house and buy a car, it is very difficult. So I started thinking and realized at the end of 1 year that even if I have to starve on road with my family, I don't want to work here. And that actually helped me to give up that job, and with nothing in hand, to sit back and relax and think about what you want to do. So you see, essential. If you just give up things that you don't want, the aim of your life becomes clearer. I think it's much more productive. People will be happier. They will be more satisfied, and they will not run after things to make them happy because they are already happy.
Yeah.
Right? So I remember how happy I was as a teenager. I just need a good book and something sweet to eat and I'll be happy. But then later I became like, whoa. When you're working in such environment, you become like that, I want this, I should have this car and blah blah and all that.
That's right.
So it's always good to move away. You move away from this culture, you move away from a bad life and diseases.
Yeah, that's right. As I said, living happy and healthy is necessary. Necessarily giving up most of the things and not acquiring unnecessary things. So that's great, Kanika. Thanks a lot again for this so much of wisdom and knowledge through Ayurveda, and it is so amazing and pleasantly surprising to know such things and how these wisdoms are so much need of the time at the moment with all these things going on around the world. So thanks again, Kanika, and we will catch up again with the next podcast very soon. And till then, goodbye.
Yeah. Thank you, Hitesh.
Thank you. Bye-bye.
Bye.
Hope you enjoyed our podcast. Do not forget to follow us or subscribe. This podcast is brought to you by Kiwi Towels, bringing Ayurvedic dyeing to the modern world.